And in our remaining time, we have a good chunk of time for Q&A. I'd like to have a discussion to hear more about your experiences in conducting this kind of work. We had many different ideas, different ways of doing this research that were shared here. And your approaches are in user-centered design. Like I said, my background is in human-centered design, where technology isn't always the focus. And so when we kicked off this session, I outlined, because we have an audience here with everyone has different backgrounds. So when I kicked it off, I shared some basic principles on user-centered design. So I have this question to all of you, really. How, and those of you who are here, feel free to unmute yourself when you want to jump in.
Recording in progress. Recording stopped.
It's so the question is, sorry, I got a little chime in my ears. How has incorporating user-centered design added value or made your research more meaningful to you? And can you speak to specific success stories that were made possible through this approach?
Maybe I can say a few words. Through focus group interviews, we wanted to understand, what older adults can do with technology, and we got some, surprising results, I would say. So, it's quite different from thinking of what all older adults can do and cannot do as a designer, and making a lot of assumptions. The actual results that you get by interacting with those users could be quite different. So in our case, the older adult that you would envision would have a lot of issues with technology. Maybe they may not want to use the technology, but we have seen a lot of older adults who are willing to try new things. And some of them are quite, I would say, tech savvy. They were pretty comfortable with using smartphones, and they get a lot of value out of it. And we realized that not all older adults are like that. So we have seen basically other extremes, but we have seen that there is at least a subgroup who could do pretty much anything that younger people do with technology. So it's it's not something that we were expecting at the very beginning. And also there are a lot of things that we learned through these interviews. We learned, whether they have any privacy concerns or not. So there's no way of knowing without, getting these actual users in the loop. Also, what they care about in a smart wearable system. Like, are there, for example, do they care about aesthetic appeal? Do they care about, sensors being lightweight? Do they care about whether it's environmentally friendly and so on? So these are very difficult questions where you cannot find answers by just doing a literature review or sitting in your desk and thinking about them. And user-centered design process basically enables us to sort of get real answers from actual users.
Absolutely. Throughout the pandemic, I started working on a project where we wanted to use QR codes, and we're like, well, older adults know how to use QR codes, but we realized at restaurants or anywhere, in order to order meals, older adults are now using their smartphones to scan QR codes and becoming more familiar with technology. And it's not until you have these conversations with people that you truly understand their lived experience. Anyone else have some success stories that they've been learning about in their projects right now?
Yeah, just to kind of echo that, really is, I think often we're not even aware of the assumptions we're making when we're designing something. And actually, by doing user-centered design, particularly with, I find older adults who I find they're so open. We've done quite a lot with young people as well. And we find older adults so much more open with their views and so much more willing to just say what they think, which makes it really amazing. But there was certainly, I became aware of kind of stereotypes and prejudices that I was holding without even knowing it, around this population, that they were all like sweet old people. And actually there was some really horrendous antisocial things happening in the community. And, and I had to look at my own assumptions that I was bringing to it. So I think that's really valuable. And I think one of the really interesting things we learned is that some of our participants spoke about aging as a continuous transition process. You know, we had one guy that said, you know, I've been here 15 years, but last year my wife died and suddenly I found myself with no support network. I'd never learned to make friends. She did all of that. And there was an assumption in the community that when you were new in the community, you needed lots of support to transition. But actually, once you're in the community, that was it, nothing changed. And actually, one of the things we learned is this need for community integration happens continuously across the aging life cycle, because each year there can be a really different set of circumstances that people are completely unprepared for. And I think we'd never have thought of that and sort of realised how it needed to be continuously supported, the community engagement, if we'd not been doing user-centred design.
Absolutely. I have a question specifically for Dr. Lee. You and I don't have as much experience in neural networks, so hopefully I'm asking, it sounds like I'm formed a question. So you described a neural network approach to repurposing drugs. And I was just curious, how has incorporating user-centered design added value or made your research more meaningful? And who were the users you were focusing on in this research? And was it other researchers or was it the patient community?
Actually, I've been thinking about that and, because, in fact, I think our user, obviously, they are actually like pharmaceutical companies.
Okay.
So, for example, we basically accelerate the process whereby you go through the drug from testing to clinical trial to market, because we are using some existing drugs which have already been approved. And then what you're saying is, okay, these drugs can also be used to treat other things which it was not originally designed for. So at least you don't have to go through all the toxicity tests and things like that. Okay. So I think one of our users obviously would be pharmaceutical companies, because we accelerate the deployment process. The end user obviously would be the elderly people who are potentially have Alzheimer's disease. But then I imagine if I interview them, what they will ask me, right? And then I would say, well, probably they say, well, we don't want to swallow drugs which are too big, give me a small, teeny drugs, so I can swallow them easily. So that is not the major, I wouldn't think that would be the major concern, okay? But in our other projects, we also have more interaction with patients. And for example, one of the things that I was very curious about Alpacian's project using sensors, right? And one issue we have is many times the users are unwilling to use the sensors. Okay, and you think that, hey, you just wear it like a Fitbit, right? Or an Apple Watch, is simple, right? Well, they just don't wear it, okay? Or they let it run out of battery and then say, hey, how come there are no data for so many days, okay? And another issue, of course, is a privacy issue, okay? So you say, well, I put some video camera in your room and then monitor your gait and see whether you're falling down or anything like that. But obviously, they don't want you to be monitoring them all the time. So I guess the question I have is, in you guys' experience, how do you overcome these kind of issues? Or how do you avoid the privacy issue? Or how do you convince them to try to generate some data for you?
It sounds like Dr. Lee is posing a question back to the rest of you who have experience in this place. Dr. I see a question from the audience. If somebody's responding, Dr. Lam, perhaps. And I was curious, Dr. Zuniga or Dr. Liu, who haven't had much of a chance to respond, if you guys have any responses to that. Yeah, Dr. Zuniga.
Gracias. Thank you. We utilize user-centered design, in fact, as an initial step for the prototype we presented, as it was crucial for improving the communication about the acquisition protocol we applied. It helped us on iterating to an easy-to-understand protocol And in fact, we have in our long-term project planning, because it's a long-term project, in fact, systematic usability evaluation, both for the elderly people and for the medical staff to evaluate the whole platform. But the real challenge in our project will be to make the acquisition protocol transparent to the user. And for that, we have to work profoundly in communication and processing aspects, because the idea is not even to say to the people that is being monitored and be able to do so, but this is a more difficult technical part of the project, but we are aiming on that direction.
Thank you. Dr. Liu, I know you did such a short presentation at the very beginning. I was curious if you wanted to add anything in the last like or so in that space.
Yeah, I think we are, as a neurologist, I'm also specialized in Alzheimer's disease. So I think what the problem we are facing is quite the same as Dr. Lee in Hong Kong. So I think the asking the elderly the response, I think sometimes they would not react as we think, and they are not quite familiar with this computer, smartphone. So I think it's a big question, and we are also dealing with that very much. And because we are dealing with the language material, we also facing the complex background, language background in Taiwan. So I think, yeah, it's a very big question how to approach the elderly. Yeah.
Great. So I'm going to freak out the organizers by asking one last question in the 2 minutes. I'm just curious if anyone, if you'd want to share what part of your work you think other researchers who have no background in user-centered design, what part of your work other researchers will find surprising if they did not have any background in user-centered design? What makes this approach so different from other types of research?
So can I just reinforce like our way of doing taking a user-centered approach is to put this is to work the other way around, rather than considering the needs of doing a good research, is to put the needs of the patients at the center of our attention when we are designing anything. For instance, if we are going to collect the data from our patients, we need to think about how we can use easy to administer tests rather than those things that are so complicated and make their lives so difficult and unhappy. And because ultimately it is for them, it is not for us. It is not for the papers, publications, and etc. So if we want to run a long way, we need to have that passion. And that is the heart of the patients, the needs of the patients, the suffering of the patients in mind. And so with that in mind, we design easy to administer tests to collect the data. We in our project for biomarker identification, we want to use blood tests instead of the brain tests because it will be very invasive. And how can we develop a sophisticated and high accuracy model? It is something that we have to overcome this challenge. But without that, there is no meaningful research. So AI for social good, and also the AD for the patients, AD research for the patients is always the way that drives us to go a mile further. Thank you.
That was amazing. I think we should end there. I saw the other participants clapping and sending emojis. So thank you so much for that closing moment. And I just want to, I guess this is all the time we have. So I need to close it down. Thank you so much for sharing your work. This was really fun for me to hear from all of you today, and I hope everyone else enjoyed it. Thank you to all of the Catalyst awardees and to everyone who joined. And this is the last day of the last session of the day, actually. So we're closing it out. I welcome you all to join us again tomorrow, which is September 27th, for the day 2 of the Global Innovator Summit. We're beginning at 9 a.m. Eastern Time. Thank you all so much, and we'll see you tomorrow.